speak.
Oh,
You
perfect.
can call me whatever you want, guys. Mary Wong, Dr. Mary, like whatever you want to call me. But we're here, we are live, and I am super thrilled because we are going to get down and dirty talking about, does IVF drugs put you into early menopause? And really, I think what we need to look at first is what the heck is menopause and why are we concerned about it when it comes to trying to conceive. And with us, we have, of course, Dr. Tanya Wild, our naturopathic doctor from Alive Holistic Health Clinic, and our lovely, famous Dr. Ari Baratz, who was actually called out to speak to this question directly through Yahoo Canada. Is that correct, Dr. Baratz?
Correct. Yes, I am Dr. Baratz, and yes, Yahoo was very, very interested in this topic. But you know, Mary, first of all, thank you very much for, as always, leading the charge with topical issues. And I know Dr. Wild has worked on this with you. So, you know, I definitely applaud the fact that you're trying to get out there, get ahead of the curve, because some of the comments and articles like that are leading to anxiety, stress, misinterpretation, fear. And that's the last thing you want during fertility treatment, when you have to be really focused and directionally set on positive outcomes, accepting side effects along the way, but making sure that the fears don't create an obstacle to even moving forward with therapy.
So thank you for saying this, because that's exactly what happens when one goes through therapy. And I also want to address those people that are contemplating, thinking about IVF on the sidelines, and then having fear, especially when I think it was March 16th that Hello Magazine posted this article. And let me find the quote from Kourtney Kardashian. I think we all know who the Kardashians are, and they're actually coming out with another reality show, and they're going to talk about her IVF journey. She, I believe, herself has 3 kids naturally, and that's not confirmed, but now she has a new partner, Kris Jenner, and they've been going down the IVF path. And she was literally quoted, "The medication that they've been giving me, they put me into menopause, literally into menopause." So why don't we speak to this? And we'll start with you, Dr. Baratz. What do you think of that quote?
Well, I think it's full of inaccuracy. With all due respect to Ms. Kardashian, I have no doubt that her feelings are unique to her, and that she may have had what I would call a pseudo menopause or menopause-like symptoms, but to actually give herself the diagnosis of menopause or to link those causally to fertility drugs is a gross misrepresentation of what likely was happening. As being a provider for over almost 20 years in this space, we know very well that the medications that we use do influence hormone levels. Sometimes we use medications to stimulate hormone response, and sometimes we use medications to suppress hormone response. Typically, the suppression, either through oral medications or through injectable, can have a side effect that is associated with hot flushing, absent or decreased vaginal bleeding, maybe mental fogginess, and generally feeling unwell. Well, those are symptoms that can be associated with menopause for some women, but the linkage is the fact that as women go through a menopause, they're going through a natural reduction in hormones, a reduction in hormones that leads to those symptoms. In the case of the fertility drugs, it's induced by a physician. So we are prescribing these medications. We typically review with our patients what to expect, what common side effects are, and most importantly, we remind them that these are reversible, very reversible, short-lived side effects. And certainly if there's any extension of those side effects, there could be something else going on. In our pre-conversation with Dr. Wild, she was saying that, look, women who are in their mid-40s typically start to enter a perimenopause that's completely independent of fertility drug exposure. In fact, we know that menopause is determined by a constellation of genetics, predisposition, exposures, maybe surgeries. And so there's a whole wide range, but just to make sure for our audience, menopause is a retrospective diagnosis. After typically 6 to 12 consecutive months of no vaginal bleeding, what we call amenorrhea, that's the technical term, that is when we describe how we describe menopause. Typically, the average age is in the late 40s to early 50s. In North America, it's about 51, but it is shouldered by about a 5 to 10 year decade. So some women will enter in their early 40s. Some women will enter in their early 50s. It's really only pathologic when it happens before the age of 40. And that we call that premature ovarian failure or premature ovarian insufficiency. And that's a whole other conversation. I can't comment from what I know about Ms. Kardashian if she fits any of those situations.
Oh, we lost your voice, Mary.
You're on mute, Mary.
You're on mute.
Right. Sorry, I was doing something else. Thanks.
No worries.
Let's just then go back. Did we mention her age? Kourtney is actually 42.
Yeah.
Right.
Let's comment on that a little bit, because I try to. I mean, it's a very short article. But there's some very interesting aspects that we should unload. So first of all, she refers that she's currently 42 or between 42 to 43, and we're in 2022. She refers to egg freezing in 2021. So that means she would have been over 40, which is also very interesting, because even though egg freezing is currently being offered across the reproductive age, we know that most women benefit when they're in their mid to late 30s. Some clinics don't even commercially offer egg freezing over 40. And we know that to have egg freezing be successful in the early 40s, you need to retrieve a large number of eggs. So I have no doubt that if Ms. Kardashian was going through egg freezing at that time, if it was offered to her, she probably went through multiple rounds of therapy, which was likely very difficult for her. Maybe she was exposed to some of those pseudo menopause like fertility medications. And it was probably very tough for her, like it is for many women, but all reversible. Now she's in her early 40s, mid 40s. There may be other aspects to her medical history, either exposure, genetics that we're just not privileged to, that might be leading to the way she's feeling currently.
Well, that's actually a great point, because also her sisters, Kim and Chloe, also underwent IVF. So that is, a little telltale sign as to perhaps there is some ovarian reserve issue, and then they are maybe we're just surmising here, right? Maybe she had many multiple rounds of IVFs, which then of course had her experience all those symptoms over and over again.
Dr. Wild, do you have anything to say about that?
Yeah, I was going to ask you more, maybe since it's March and it's Endometriosis Awareness Month, just as a side kind of question, unrelated. I don't know what kind of, health condition she has, but I know that with endometriosis, it can sometimes reduce the reserve because of the oxidative stress. It can kind of affect egg quality. And so in the case where women sometimes need to be kind of put in this temporary amenorrheic state, that would be a kind of example where some medications might make a woman feel like she's in menopause. Can you speak to that? Like in menopause, as you said, defined is not until you're like 1 year later after no periods naturally, right?
Yeah.
So the symptoms people often confuse, right? They think that menopause is like hot flushes and can't sleep, but that's potentially peri-menopause, and that can last for years. So talk about a situation where, a woman might need support with medications, and why would she be put in that amenorrheic state?
Well, there's no question that, and that's a great topic for another discussion, is endometriosis, but that's an example of a condition, a gynecologic condition that has two big sides to it. There's definitely some relationship with fertility, and many fertility patients will have concomitant endometriosis, but then there are patients who are seeking control of their endometriosis for well-womanness, either pelvic pain or discomfort. And we know that endometriosis is very sensitive to hormones in terms of estrogen, and using drugs like GnRH agonists or antagonists or birth control pill, anything that suppresses hormone flux, which could be similar to a pseudo menopause, is one of the strategies that we use. So absolutely, there may have been some pre-treatment or some mutually exclusive treatment that was offered to treat endometriosis. Again, as per Mary, we're really just guessing what she has.
Right.
And I actually want to pivot back to one of Mary's points, which is also lost on many people, is that, so you see the Kardashian family, and yes, maybe they all went through treatment in their early 40s. So you think there's got to be, and we know them as sisters. They all look very similar, and they have a TV show. And so you think there's got to be some genetics. That's how genetics work. But we don't want to lose sight of the fact that there might be an extra layer of complexity here. There may be a male factor, or there may be some complex male and female factor going
Thank you for
on.
saying that.
Yeah.
And very often we know that a lot of the therapies that we offer are not actually targeted at true infertility, but they're targeted at subfertility, meaning many people have an agenda. They may want to have a larger family, and they're just not happy with the pace at which things are happening. So they might actually not need advanced therapies, but they select them because they just want to shorten the latency to success. And we know that in certain areas, in certain parts of the world, in certain jurisdictions, certain markets, fertility treatment is almost treated like a cosmetic procedure where people are going through aggressive therapies, perhaps a bit overzealously.
Sure, especially if you have the means, and certainly the Kardashians do, right?
Yeah.
So whether they need it or not, they might have just had gone through IVF because they're impatient.
Yeah, I mean, in all fairness to Kourtney, I mean, if she's in her early 40s, having some connection with a fertility clinic and certainly advanced therapies like IVF would be very appropriate.
Yes.
I think the issue we have is what is she describing? I mean, is she describing a normal set of side effects that we would expect to counsel patients on, or is she describing something that's completely out of the ordinary? And I want to make sure that everyone online knows that the reassuring part about IVF therapy is, number one, it's been around for a long time, and its current modern form is not that much different than what we've been doing for the last 20 years in terms of patient experience. Number two, it is really wrapped in safety. The long-term data for IVF, both in terms of the short-term experience, the experience on the offspring, is quite reassuring. And I think we have to really make sure that we use this plug by Dr. Kourtney Kardashian, sorry, Dr. Kardashian, maybe she is a doctor, Kourtney Kardashian, as an opportunity to remind us that it's tough, but it is surmountable. And fortunately, it is quite a safe procedure, and the risk profile is excellent.
And I love it that you're speaking to that this is an opportunity for us to educate properly, because here's the other thing when it comes to media. Media isn't media unless it provokes some kind of fear or shock, right? So it could have been that she says this, but it may be also put out of context. So you kind of see half truths.
Well, I'm sure that if we put a microphone in any of your waiting rooms at Dr. Wild, yourself, Mary, or in our waiting room, and just polled 10 patients or 50 patients as they walk out, they would sound a lot like Dr. Kardashian. Like they would be, I mean, maybe you could share, like, what do your patients typically describe when they're going through fertility treatment? How do they feel?
I feel like a lot of women do report what Kourtney was also complaining about, which is weight gain, but it's like a temporary kind of water retention in the abdomen. I mean, if you're retrieving eggs, your body naturally tries to fill up that space. So you're going to have some bloating in the abdomen. If it's usually mild and way more mild compared to the past when there's a fresh transfer and you're at risk for ovary hyperstimulation syndrome, and that's no longer a risk, right? So there's the weight gain, and she's targeted because she's in the media. And so she has like a little bit of weight gain, and people are saying, oh, are you pregnant? And she's not, and she's having procedures perhaps. And then she's saying that, that affects her appearance. And so, and then also my patients will report that, sometimes in some cases they'll have kind of those hot flushes. I didn't personally, because I went through IVF twice, and I felt amazing on IVF. I was like, bring on the estrogen. And I also went in with a healthy mindset because I was so resistant to it for like 3 years. And then when I finally decided, okay, I need help, I have polycystic ovary syndrome, let's go for it. I felt amazing. And I programmed my brain to recognize that, okay, this is like, I pretended that the gonal F or the gonal agonists were basically like, juicy purple potion that were going to help me, produce juicy eggs and feel like a really positive mindset and mind frame. And I had a mild bloating, but I didn't really have much of a difference. And it could have been for some people, maybe the high estrogen to the low estrogen during that phase that gives you that feeling of like a night sweat or hot flushes and whatnot. But I didn't experience that. I do know women experience it. I think it depends on where they are at and what conditions they have. And
I think that's a really interesting perspective too, which is, you're sharing your experience. If you have a provider, whether it's in TCM, in naturopathic, nutrition support, fertility care, if you share what your concerns, your fears, your ideas are, all of us are more able, more equipped to address them. I mean, I have some patients that say, look, I don't care that I'm not going to make 10 to 15 eggs. I'd rather make fewer eggs and feel better on the medications. So that's just an example of a patient-centered approach. Or for example, when we talk about transfer protocol, like so when we actually have the embryos and we're now preparing to thaw them and place them in the womb, that's another moment where Ms. Kardashian may have been exposed to those peri-menopause downregulation medications that cause those symptoms, or those pseudo menopause symptoms. But again, there are other protocols that have been developed. So if someone wants to make things a little more natural or a little less medicated, there is some flexibility. I mean, it's not look, it's not exactly a buffet where you can pick anything and everything you want, but I think there is definitely a menu that can be navigated and one can select around. We're moving much more towards natural infusion of protocol. And I think the embryo transfer is a classic example. Like, for example, if she was using her frozen eggs, then she may have gone through some medications that she may have not had to use if she was either asking the questions or properly offered them. So that's also another situation.
So I'm going to pipe in here and speak about to my own experience, because I did 8 attempted rounds of IVF and thankfully have a kid to show for it. But I also did not experience the traditional hot flashes through some of these meds, but I did have that crazy brain fog where I had, instead of memory, I had memory lapses, which I had never experienced in my life. So that was actually quite alarming, where, you know what, have you ever like lost your keys? And then when you find it, you go, oh, right, that's where I put it. And for me, it was in that phase, I'm like, I don't even remember putting it there. And that was crazy to me. Right.
And do you think that could have been more because of all the anxieties around all this investment of time and procedures versus
for
the
me,
hormones?
No, because I was pretty calm. And I think that was drug, right? And again,
or personal hormones in response to drugs.
The hormone, yes, that's more accurate, right? So the hormonal response was part of it for sure. Yeah. And some maybe arthritic symptoms, but not true hot flashes. But certainly with different patients, and you can all attest to this, everyone is so different and unique. Some respond severely in where they have those very traditional menopausal symptoms like the hot flashes, and then others where it's like nothing, right?
Well, I think we have to remind patients and those going through fertility care that it's not something that requires a complete pause of your life. Like, people still have to work and, they have many rules, but it does fill up a very big part of your life, like meaning either emotionally, physically, you're doing something you don't typically do. Like our patients come to the clinic maybe 3 to 5 times in a 2-week window. Most people we're helping are otherwise healthy and well, so they're not used to being medicalized. And then they're visiting both of you. So that's another set of visits. So they're definitely filling in their schedule with stuff they normally wouldn't fill in. And I do have patients that really focus on trying, and we live in a world of professionals. Unfortunately, the onus on fertility care is it's very gender biased towards female. Like the female needs to be here more, unfortunately, even with all of the partner support. And even if we have same-sex female couples, it's the female that's going through the therapy that typically has to be here. And so my point is that I don't ever want to minimize the commitment that's required to be successful. But I do want to acknowledge that it can erode some of your time, right? Like you're waking up earlier, your sleep might be disturbed. You've got the fears of the success, and it's ongoing, right? So it's not just one event. It might be multiple events. So we have to, next month is Fertility Awareness, Canadian Fertility Awareness Month and week. And it's a homage to those people, men, women, young and old, that are going through this. And we have to recognize that even though fertility care very often is discriminated against, it doesn't get the same kind of press as cancer and other chronic or acute conditions. It's a lot. And it creates a lot of anxiety, a lot of fear. People reach out to articles like this, whether it's real or not, it really can throw them off. So I'm acknowledging everybody. And I think these are conversations we have to have so that we can reassure.
I think that's a really amazing point. It's almost like a second job. I worked through the 8 years on and off, just taking breaks to have my two children. But definitely, you're not just jumping into IVF. It's a process. First you're trying, and then you're going through IUIs. And usually it's a process of many mornings that you're getting up early to jump the lines, you get to work on time. So yeah, like that's a great acknowledgement. And then you're right, it doesn't get recognized as chronic illness the same way as cancer or other illnesses, but it's, the emotions have been associated with the level of grief that one gets when they get a diagnosis of infertility, as similar to a person who gets a cancer diagnosis, because it's a big deal. Like, you lose all sense of control. And yeah, so thank you for that acknowledgement, Dr. Baratz.
Yeah, and we can't forget how it really intertwines with work. I mean, work can be affected, and that's why, typically I'll say you might want to tell at least somebody at work, and so that they'll have your back, because there's also fears for women in particular about, oh my gosh, am I going to lose that job, or am I going to not get that next pay raise, or have a bad review because I'm not at the office as much, or even showing up at work. There has been some help through COVID, actually, because if people are working from home, there's a little bit more flexibility, but it's still so super challenging, and we can't underestimate how challenging it is when you're working at the same time, because really it's another full-time job.
So we have to bring that full circle, meaning that if someone, because you don't have on your forehead, I'm a fertility patient, right? So either you have to confide in someone at work, someone you report to, because if you're having brain fog, fatigue, hot flushes, can't find your keys, whatever the case is, how are you going to mitigate that? Right. Mm-hmm. So we're living in a very interesting time in the corporate world. As you know very well, many companies are expanding health benefits to incorporate fertility care, which has two outcomes: the obvious, the financial support, which we need, but the recognition. This is not a lifestyle choice. Okay. This is by WHO standards, a medical condition. So yes, it's not something people typically die from, but it's something that people die for. It's something that people drive for, literally and physically. They come from very far away. Yes. They put all their energy behind it, their investment. And so you don't have the double penalty of going through the fertility treatment and then losing ground at work or in your personal life. Yeah, when we say work, I mean anything outside the fertility clinic. I mean, relationships can be strained. And so Ms. Kardashian's focusing on her transient symptoms in an environment where I suspect that she has lots of financial support, and emotionally, I have no idea what her situation is. But I think it's really a distorted reality. Many patients don't have the luxury of an unlimited budget of time. They don't have the type of media attention and extended family even, right? Many people are going through this really alone because they don't feel comfortable sharing what they're doing.
And so I wanted to argue that point about dying, because it's like a piece of you is dying every time you have a failed cycle, or every year that you still don't have a child.
Right. Well, no, I'm not arguing with you. No, but what I meant is that at the end of the day, there might be emotional scorn and there is physical, but we have to acknowledge that the part that might be more difficult for fertility patients is that there is that next day. And if it doesn't work, they have to dust it off and continue living with anxiety, depression, PTSD from their fertility treatment. In the case of some of the other conditions, the recovery, it's a bit of a different recovery. So, the three of us on this line take this very seriously. And the number of patients I've had to sort of spend time with out of this article, it really takes away from our focus. So I ask this is a call out to all the famous people out there. If you're not sure, ask your doctor before you go online and start claiming certain symptoms, and make sure you qualify it, because you may or may not be helping people that the large audience that you're speaking to.
And then the media too choose their words carefully and how they, present the dialogue that they've heard from the person, because it's possible that it was also selectively chose, like, I've done in media and TV, and what I've said is not what it's actually then comes across as when it's been on television.
Well, I think the only line, thank you for mentioning, I think the only line that probably needed to be, the only word that needed to be removed was, or phrase was, literally into menopause. If she just made the word literally into like in a menopause, or, but the literal word suggests fact, that you are taking drugs and therefore you are in a true menopause. If they put the word pseudo in there, if they just added some curves to that, I think we wouldn't be having this conversation. It would have been a lot easier. But when you make these claims, I think that's where we have issue and problem. So full acknowledgement, she was in a pseudo menopause, probably.
A menstrual pause.
Yes.
Yes.
But no, she was in her hormones, if we measured them, they might look, well, not her hormones, but she would look like, she would sort of felt like someone. But if you looked at her ovaries on ultrasound, they probably would not have looked menopausal. In fact, I have a colleague that I think one of the articles actually at some point puts a picture of her ovary on the screen, and it looks like a polycystic ovary. So remember, not having periods can have two extreme experiences. It can be someone who's in peri-menopause or ovarian failure, but it could also be polycystic ovary syndrome. And you need to figure out where you fall, because those are very different diagnoses with very different approaches.
Yes, absolutely.
And so just
to
one
recap,
last. Okay, go ahead.
Oh, no, you go, Mary.
Well, I was just going to go back to the point of, when a person has a failed cycle, you are going to be so triggered. So anything pops out of your mouth without even thinking, right? You're being interviewed, you're emotional. So I don't think it's going to be, oh, let me really think about what I'm going to say. It's just coming completely from their emotions. And in that moment, yeah, I feel like I'm totally in my menopause now, right? And then we take that as if it's fact. And for media, it's great to put that as fact, because that sells more papers.
Right. So IVF does not cause menopause, but it can cause a menstrual pause and menopause-like symptoms. And actually, one last question, Dr. Baratz, are there any scenarios where a woman might go into official menopause if she has an IVF cycle? Can you speak to the one situation that might happen?
I really, it would be very difficult to make that linkage, because we do have women that are very low egg reserve and maybe approaching that perimenopause that you're talking about, like that time period that shoulders the actual menopause. But the IVF was just piggybacking on their genetic path, like, their predisposition. So if someone was a heavy smoker in their life, if someone had a family history of premature ovarian failure, they were likely, or ovarian reserve numbers that were much lower, they were likely destined to enter an early menopause. And in fact, those are the people that are consuming most of the fertility treatment. So it's really, you can call it a coincidence or a reaction to the situation, but it's not what pushed them over. It's just a convenient link. But I don't think anyone has ever shown that would be the case. There's really no scenario. The only time we sometimes see a very close link is if someone was either surgically or medically put into menopause by either chemotherapy or some kind of extensive surgery, and they may have had an IVF cycle just before that occurred, because they were trying to preserve their eggs. So you might think, oh, it was the IVF was the last fertility experience, and then I went into menopause, but they were really not tethered to each other at all. So no, I can't really think of a case.
Perfect. Just to play devil's advocate, I know, oh my gosh, I just have to get it out of my head. So I did tell you I went through 8 rounds of drugs, right? So, and after which I actually went into menopause at 47. So to me, that's a little young. Now, is that causal? Is that just I was destined to? I'm actually not 100% convinced either way. And I'll just kind of leave it at that. And Tanya, you're menstrual. That's not a secret, right?
No. I have PCOS, and apparently I might menstruate many more years than 50.
It's all coming out now. It's all coming out.
I'm 44, so there you go. Yeah. And so, yeah, no, it did not affect, obviously that. And I think, there are going to be scenarios like you're saying, if you had a depleted ovary reserve, Mary, perhaps if you're if you had tested it, maybe
Yeah,
it was
I'm gonna have a little conversation with Mary. So, there's a few models. So obviously we don't have the true randomized control data to support what you described, like taking infertile women and randomize them to treatment or non-treatment and then seeing what happens to them. It would be very difficult to do that. But a few case studies that you should consider. Number one, there are many parts of the world. I mean, we're very fortunate in Canada and Ontario, where I am right now, that we do have support from government fertility care, and other provinces are coming around to that. But there are some other parts of the world where there's very aggressive support from government. So there are women that will go through dozens of IVF cycles with medications, and no one has reported that the jurisdictional or the geographic menopause is higher or lower in those women. And they're going through double-digit IVF cycles.
Right.
So Mary, you went through a lot, but they're going through even more. So that's one case. And the other case, which may or may not be linked, is when you look at people that are egg donors. So egg donors will typically go through many rounds of aggressive IVF, up to 6 or 8 cycles. And when you look at them long-term, they don't go into an earlier menopause or have any long-term fertility care either. So again, these are cohorts. They're a little anecdote, but there can be large groups of people. So really no one is showing, because you think if there was some linkage between therapy and menopause, you would have seen that in those groups, and we're not. So I'm fortunate I'm fortunate for us that that's not the case, because it makes you feel even more comfortable that we can do what we're doing. And I'm going to go a step further and say, this is just another example of how many people are questioning the safety of fertility treatment, not even just on the patient, but on the offspring. And there's a lot of studies coming out showing perinatal, obstetrical safety, or potential risk. So it's not over yet. Like, people really are still questioning the safety of IVF, but I would say for now, if that's what your doctor is offering you, or that's what it looks like, yes, there is some risk, but that risk is minimal compared to the potential benefits that you will be reaping from this.
Awesome. Thank you so much for that. I'm glad I actually brought that last thing up. And we will definitely have you back and to discuss some of these things that we've been mentioning, like the offsprings, if there's any potential side effects. And we've already done one about ADHD and what was it? Cancer for women. And so you guys can go back and check back My Fertology, the podcast. I don't actually know the episodes right now, but you can look them up. And we did talk about that, but there's certainly so much more to talk about. Right. So we can't wait to have you back.
Thank you. I accept the invitation.
Wonderful.
Okay. All right. Well, are you saying goodbye, or are we still hanging out?
Yeah, okay. We are going to end the call, right? Are we on Facebook Live right now, Mary?
Yeah, so we'll say goodbye, and I'm